Since the first IQ test was designed over a century ago, tests that aim to measure intelligence have steadily grown in popularity. Today they're used in a variety of settings by clinical, educational, occupational and forensic psychologists. Intelligence tests have two main functions. First, as a diagnostic tool used by psychologists to diagnose a clinical condition or assess an individual's learning needs, and second, for the purposes of screening and selection, such as in school admission and job recruitment. In this film, psychologists will explain how they use intelligence testing in their practice and talk about the advantages and disadvantages of testing.
All of these tests are what we would describe as psychometric tests, which is a particular term used in psychology, which is sort of what it sounds like, psychometric, measuring psychological abilities. And the understanding how psychometric tests are developed, tested and can be used is part of the core training of a psychologist. You can do in the amount of time I've got.
Dr. Jenny Taylor is a clinical psychologist working in a child and adolescent mental health service in inner London. She uses well-established intelligence scales as part of a range of tests when assessing young people referred to the service.
The standard cognitive assessment that we'd do if we were screening for a general learning disability or a specific learning disability would be one of the Wechsler tests. Okay. We tend to very broadly think of two large areas of cognitive functioning, one being the more verbal, abstract thinking type of functioning, and one being the more visuo-spatial, managing the self, the body, the environment, how things physically fit together. Doesn't necessarily have anything to do with words.
The Wechsler scale is comprised of 10 subscales, which assess distinct cognitive abilities such as working memory, processing speed, and perceptual reasoning.
The most common referrals to ourselves would be referrals about a child being on the autistic spectrum or having ADHD, attention deficit hyperactivity disorder, or children or young people who are presenting in a very distressed manner, so appearing to be very depressed, self-harming.
The performance on all 10 subscales is used to determine a person's overall IQ.
So the first one we're going to do is called block design. Have a look at them. See, on some sides they're red, some sides they're white.
And they're half and half.
Some sides are half and half. Yeah, exactly. Okay, right, off you go.
The participant uses the blocks to reproduce a pattern presented by the psychologist. This assesses their perceptual reasoning.
Done.
Great.
Other subscales in the Wechsler test focus on the speed of processing.
And hold on. Now, don't be put off. I have a stopwatch here. Yeah. And you have quite a lot of time, but it's just so that I know how long it takes you otherwise. Okay, so what I'm looking at is how quickly you can do it. So you might have a child, a young person, whose ability to reason about abstract ideas wasn't very sophisticated, but their brain can actually move forward with things very quickly. As being a different sort of ability from understanding more complicated concepts. So I'm looking at a whole range of how they approach the task. We also would be measuring someone's working memory. 8, 6 tests include something called digit span, where I literally give you a list of numbers and ask you to repeat them back to me.
Oh, 3, 8, 9, 6. No, I've completely lost that one.
Let's try another one. You say each number approximately a second apart, at the same tone of voice, and you drop your tone of voice on the last one to indicate that you've finished. 3, 2, 9, 1. So there are very clear, specific ways that you have to give each element of the subtest to make sure you're measuring, one, what you're supposed to measure, but also the same as a colleague would be measuring if they were measuring the child on a separate day in a separate place. How many you can do?
Administering an intelligence test also involves observing performance.
I'm looking at how they're doing it. Are they just randomly over and over again doing different combinations? Are they looking at the pattern, starting from a corner and gradually moving through it? Are they checking when they're done, or are they just putting it together and saying to me, done? Or are they putting it together, looking at it, making sure, and then saying, done?
Being able to interpret the results of a test are a key part of the process. Psychologists need to be trained in doing this and have to be aware of the factors that might affect the test results.
The interpretation of a lot of the tests will only be done by psychologists, because to interpret them fully you need to understand what sorts of things they are, how the test is built and how you can interpret it to be able to work out whether you can use the scores from that, how you would interpret them and so forth. So an understanding of how psychometric tests are developed is essential to interpret something appropriately, given that the person who you're testing is a real human being who could be having a good day, a bad day. Start off like this. The majority of these tests are restricted usage, and that's to make sure that they are actually only used by people who are qualified to use them appropriately and interpret them appropriately, because they have quite significant implications, and interpreting something incorrectly and giving someone an incorrect idea about whether or not they have a learning disability obviously is a serious ethical issue.
How test results are communicated to non-specialists is also an important part of the process.
Join up some dots which have numbers.
Sarah Mackenzie Ross is a clinical neuropsychologist, and like Jenny Taylor, she has used intelligence testing in her work.
People often ask me, should I report IQ scores in reports that go back to doctors? And the answer I always give is no, because nobody knows how to interpret it.
Well done.
And actually it's far more helpful to say to a doctor, this person has working memory problems, or this person, but they're very strong in a different area. And to actually give the qualitative information is far more helpful.
Sarah Mackenzie Ross uses the test as part of her submissions to court when appearing as an expert witness in court proceedings.
I'm frequently asked to examine patients who perhaps have been in some kind of accident or an assault, where there's a question about whether or not they've sustained any lasting brain damage as a result of that. And so my job in that situation is to put them through a battery of tests, not just IQ tests, but memory and all sorts of other things, in order to answer the question, have they lost some cognitive ability? And if they have, what does that mean? You know, you want to be standing up there saying, I've used the latest version of a Wechsler IQ test, and it's universally accepted worldwide as capable of doing X, Y, and Z.
Unlike many tests available on the open market, Wechsler tests have been standardised by being administered to a large sample of the population, often thousands of people. And test norms have been developed that provide the basis for interpreting results.
I think the most important thing to be aware of with any psychometric measure, so that's any standardised measure of psychological functioning, is that it's only as useful as the group of norms is relevant to the person in front of you. So by the group of norms, it's a slightly odd term we use, meaning the sample group that the test was administered to, in order for me as a psychologist to know what I'm comparing against. Now, the big major tests, such as the Wechsler tests, put a huge amount of time and energy into making this so.
The test has also been given not only to healthy people in the population to enable us to know what normal people do on this test, but it's also been given to large numbers of clinical groups, so people with dementia, people who've had head injuries, people with learning disabilities, and even people with psychiatric conditions like anxiety and depression. And what that means is if I have a particular patient who I'm examining, I can look at their profile on the Wechsler and compare it against other groups.
As well as in clinical and forensic settings, intelligence tests have traditionally been used by educational psychologists to help identify children requiring additional support with learning. Understanding how to administer these tests forms a core part of the training.
As part of our training as an educational psychologist, we do study the theories of intelligence and multiple theories. We look at the historic roots of the IQ tests and how it's been used and how it's been used within the education system. And I think that's really important to have that theoretical knowledge. They're key to understanding and analysing the information around intelligence.
However, in the educational setting, intelligence tests have also been adapted and then used both to select students as part of the admissions process and then stream children according to their abilities. In the past, exams based on intelligence tests were central to the secondary school system throughout the UK. Today they are less common, but they're still used to select and assess children both in the state and independent school sectors. Their continuing use raises concerns for psychologists.
Within the independent sector, there is a rise in popularity of using IQ tests to sift out potential candidates for schools. And I think what an IQ test can show is that you can teach people and they do well within a testing situation. It's just such a limited testing situation.
This use of intelligence tests as tools of selection also happens in other settings, such as in job recruitment. Here, the tests are often specifically designed to the point where they bear little resemblance to the intelligence scales used in clinical settings. Almuthe McDowell is an occupational psychologist who designs intelligence tests for job recruitment.
Welcome to our virtual store.
I wouldn't really use the term intelligence testing in my practice. I would refer to the term ability testing, and that really has become the accepted terminology. Here's the manager, so he's going to be asked to deal with Debbie in a moment. The way that we use ability tests actually has changed for the workplace. We now use them very much as what we call a measure of maximum performance. So if you have a job position, a vacancy available, and you've got 200 applicants applying, what you're really interested in out of that pool of 200 people, who are the 10 very best, let's say. So ability tests have become much more sophisticated. There are also many ability tests that actually have been specifically written for the workplace. So they have items in them that relate to a work context. So for instance, they will ask people to imagine that they're a manager in a big company, that they now have to interpret this bit of financial information in a spreadsheet. So how would they interpret it? Is, answer A or B or C the right one? And the reason behind that is that people actually often don't like sitting an ability test very much. It's not one of life's pleasurable experiences. And people are even more hesitant to sit an ability test if it doesn't look as if it's got anything to do with the job that they are applying for. So that's one of the reasons why we now have quite sophisticated tests that actually look and feel much more work-related and work-relevant.
The reasons why IQ-based tests have been so popular as tools of selection in education and job recruitment is that they are relatively easy to administer and they have been seen as good predictors of academic achievement and job performance. However, this is highly contested.
If we start with school first, IQ tests are able to predict your eventual exam grades only moderately. And in fact, a factor that's far more important than how intelligent you are is your personality and your capacity for self-discipline. In fact, there's been some research recently that shows that children with a high level of self-discipline who set targets for themselves and work diligently and don't give up on tasks perform very well at exams and may actually have a lower IQ than somebody else who doesn't perform as well in the final exams.
The extent to which scores on IQ tests predict performance in the workplace is also disputed.
IQ will tell you roughly what type of occupation you can go into, whether you're capable of being an astrophysicist or not. But once in that occupation, personality becomes far more important, because IQ tells you nothing about somebody's capacity to do teamwork, to empathise, to lead, to stick with a task, to be creative. It doesn't tell you about any of those factors, and these factors are really important in the workplace, and they are the ones that predict how fast you go up the career ladder and your eventual financial income much better than your actual IQ.
Intelligence testing clearly has limitations in this area, and this is a view that Almuthe McDowell agrees with.
The best way to think about using ability tests in a work-based context is to be using them alongside other measures. So you might be using, for instance, an ability test, a personality questionnaire, a motivational interview.
The debate around the efficacy of testing is further complicated by the lack of agreement among psychologists of what they are actually testing for.
Intelligence is a really interesting concept. We understand that that's what differentiates us from animals, and yet we can't actually agree on what we mean when we use the word intelligence.
I think intelligence is one of the most hotly debated ideas in psychology, both academic and clinical psychology, but also popular psychology. One of my preferred definitions of intelligence is the ability of the organism to adapt itself to the environment in which it finds itself. And that's a term that could be used about intelligence in other creatures as well as human beings, but is deliberately extremely broad. It's not saying you are intelligent if you can memorise a book of text or if you can add up these numbers. If that's the only thing you can do and you're in a different sort of situation that you can't manage at all, is that intelligence or is that having a particular skill?
The lack of a standard definition of intelligence is further complicated by the wide range of products marketed as intelligence tests and which are readily available to the public to buy.
You will find thousands of tests on the market claiming to be intelligence tests. Some will only look at one function, like vocabulary or reading ability. Some are constructed to look at a whole range of different cognitive functions, like working memory and perception and learning, in addition to verbal and visuospatial skill.
There are many countries in this world where there isn't anything equivalent, so people will just buy tests off the shelf and then use them. But actually testing is, it does require a lot of skill and expertise, because it's not just about, pushing some buttons and calculating some numbers. It's also about understanding the testing process.
Intelligence tests, when properly designed, administered and interpreted, can play an important role as a diagnostic tool. But their use is spread far beyond the specific context for which they were designed. And this is where the limitations of intelligence tests become more apparent. In Film 2, psychologists discuss these limitations and look at how factors such as culture and class impact on the design and performance in tests.